Hello, could you introduce yourself, please?
Sure. Yeah, my name is Susanne Fengler. I'm from Hamburg, Germany, and I'm from the Association of Dermatological Prevention in Hamburg, yeah.
Can you tell us a bit about your research here and your poster presentation?
Okay, so actually the poster is about the skin cancer screening education study, which is a very comprehensive study to evaluate the efficacy of skin cancer screening education training that we do in Germany for the nationwide skin cancer screening program that we have there. And it hasn't been evaluated yet because in Germany there is no control group anymore. So many family physicians and dermatologists have been trained that we can't find a control group. So what we did, we went actually to look where we could do it, and we found Alberta, Canada for that. So it's in the country of the World Congress, which is really nice. And we're actually, at the moment, we just started the study just started running, really. So this is just the first educational outcomes. There's much more to come. And so we will evaluate the training in educational outcomes, in epidemiological and clinical outcomes, and we also have a patient questionnaire on patient-rated well-being. And so we do it in Calgary and Edmonton. Calgary is the intervention group, which gets the training, and Edmonton is the control group where they don't get the trainings. And participating physicians are family physicians and dermatologists. And we also work together with two principal investigators from the University of Calgary and the University of Alberta, which are Dr. Lynn Robertson and Dr. Gordon Searles. And so far I can say that we have recruited 70 physicians in Calgary and 10 in Edmonton. So Edmonton is still lacking a bit, but that's because of the incentive. The training is the incentive, and they get CME credits for it, and that comes after the screening phase. So physicians are not so easy to be convinced. And so here on the poster, actually, it explains the background and then the training content, which is epidemiology, etiology of skin cancer, risk factors and risk groups. But also what we have is counseling and primary prevention as a big focus, and communication. So actually, how does the physician bring the information across to the patients? And also how screening programs actually are evaluated, because that's also what we see in Germany. Lots of physicians don't really know what a screening program really is, so that's why we do that as well. And so here, these are the first educational outcomes from the first 20 participants of the intervention group, who they filled in a pre and a post test at the training, and we evaluate knowledge of screening in general, knowledge on skin cancer, diagnostic accuracy, that's the knowledge test, and then we have on a Likert scale from 1 to 6, they can actually tell us their confidence levels, or the level of confidence on how confident they are in primary prevention counseling, how confident they are in making a presumptive diagnosis of melanoma or non-melanocytic skin cancer, and how confident they are in actually counseling the patient on self-examinations. And so the results were that overall there was actually an increase in knowledge and also in the confidence levels. And the biggest increase was actually in the confidence levels on primary prevention counseling and self-examination, which is actually good. And it maybe also shows that there is a big key point in the training, which is on actually the communication aspect, which is nice, I think. And interestingly, the diagnostic accuracy went down a little bit, just 0.1. And the explanation might be that because in the training, the physicians get actually more sensitive towards what skin lesions look like and how it all works, and so they might get a bit confused with it in the beginning. So it's actually really important that they then go out there and screen patients to get more security on the diagnostic accuracy, I would say.
Well, thank you very much.
Thank you.